that deadly cruise ship Hantavirus outbreak, Spain's Secretary of Health says the United States agreed to send a plane to Europe to bring back Americans stuck on that cruise ship that really is at the center of a nationwide and an international story, and that's a Hantavirus outbreak, a deadly one at that. So earlier this week, 3 passengers confirmed dead. 3 others suspected of infection left the MV Hondias near Cape Verde. The ship and nearly 150 people on board now head towards Spain's Canary Islands, where that vessel drops anchor. They're going to do it offshore, they say, to reduce contagion risk. At least a dozen countries now trace and monitor nearly 30 passengers who left the ship during early port stops before leaders were able to confirm the outbreak. 2 British nationals tested positive for the virus, with a 3rd case suspected. So let's talk about the picture here in the United States. Health leaders in Arizona, Virginia, Georgia, Texas, and California, they monitor passengers who came off the ship. Each state reports no signs of illness so far. Still, though, this is starting to dominate and percolate a lot of the conversation on my social media feed, and we know Tom Hanson, CBS News correspondent, is also seeing this story. Tom, this story is getting bigger by the minute. There are reports from ABC echoed all over the internet that the Centers for Disease Control is now classifying this outbreak as a level 3 emergency response. So what specifically does that mean, level 3?
Reed, that's a great question. And actually, as it happens, I have the sheet right here, the diagram. So basically, a level 3 is the lowest level that the CDC has. Essentially, they are monitoring this, the spread of this virus. They are allocating some staff from the CDC's Emergency Operations Center who may assist in any sort of response. And then essentially, it's a wait and see. So level 2 is ramped up a little bit. And then level 1 is the highest level of response reserved for critical emergencies. Think COVID-19 becoming a global pandemic. That would be a level 1. One of the reasons that health experts aren't terribly concerned about this, they're monitoring it, they're taking it very seriously, but they're not overly concerned, is because of the transmission of this virus. We know that this virus is incredibly difficult to spread on a wide scale. As we've mentioned, Dr. John LaPook, Dr. Celine Gounder have said that this is not a pandemic-causing virus. That's because even in this strain, this Andes strain, which transmits from person to person, it is incredibly difficult to spread. There are instances where people have slept in the same bed, for example, one person positive, the other person never ends up getting the virus. And that's because you have to be in close proximity for a prolonged period of time, maybe breathing the same air very closely together or exchanging, saliva, things like that, for this disease to spread. Now, the other parts of the hantavirus, the other many strains of the hantavirus, typically are spread through inhalation of particles that come from the rodents in that particular region. We're talking about fecal matter, we're talking about urine, we're talking about saliva from rodents. So generally speaking, most hantaviruses do not spread from person to person. They only spread from close proximity to that DNA material from rodents. So overall, this is not something that needs to be maximum alarm bells sounded. However, it is particularly concerning, I will say, given those 30 passengers who got off of the cruise ship early from St. Helena.
Right.
They, as you mentioned in that map, are from at least 12 countries. Those 6 Americans, of course, are being closely monitored. And there's a coordinated response here. The CDC is not only working within their own department, they are coordinating very closely with the WHO and the State Department to monitor all of these cases and track new cases that could pop up. We are just learning of 2 Britain passengers who were self-isolating. They suspected that they had hantavirus. That has been confirmed, and we are learning of a 3rd British national who has also raised concerns about contracting the virus, although that is not confirmed that they do in fact have it yet. So we're going to be watching that very closely, Reed, but a lot of threads to pull on here.
Right, a lot to stay on top of. And you cite those scientific realities that would seem to communicate the need for a tempered response. Certainly all of us paying attention to it, but not those alarm bells that you cite. Still, though, I'm seeing an enormous response on social media, because we all saw the social media photos and videos of those passengers coming off the ship. And a lot of people want to know, well, where are those people? Because they saw the people who were taking them off wearing the masks, wearing what looked like a very intentional sort of precautionary set of outfits there. So where are these people, and what kind of concerns do you think can be allayed by those scientific realities that you cite?
You know, well, every medical expert who you speak to basically will say that the 3 people who were evacuated in that high stakes evacuation that happened in the early hours a couple days ago and ultimately allowed the ship to continue on to the Canary Islands, those 3 passengers are all in specialized hospital facilities in Europe. They were flown to the Netherlands and then dispersed to hospitals that had the resources to treat the symptoms of this virus. So currently on board the ship, nearly 150 people, none of whom are showing any signs of symptoms. You know, the WHO has also gone on board the ship. They have been monitoring the health conditions of all the people who are holed up in their cabins, isolating on that ship as it goes toward the Canary Islands. So far, those people have not shown any symptoms. One of the things I want to talk about here, though, is the logistical component of this, because just because the ship gets to the Canary Islands doesn't mean the people are going to get off on the Canary Islands. That has yet to be seen. It's expected to happen on Sunday for them to anchor off the coast of the Canary Islands. And then it's going to be a coordinated response. There's going to be a lot of medical evaluations of those people who are still on board. And then we are told passengers will disembark by Zodiac boats, small groups, 5 people at a time, from the ship to the port provided by the ship owner. Now, as for the Americans who are on board, which are more than a dozen Americans on board, the U.S., we are learning, has in fact sent a plane alongside the UK, which is also sending a plane to evacuate those passengers to their respective countries. So the Americans, in theory, if they get a clean bill of health, will be evacuated off of the boat. They will then board a plane and fly back to the United States, where no doubt they will be under some medical evaluations when they get back here to closely monitor if any of them develop symptoms. One of the last things that I'll say here is the incubation period for this virus is so long. John LaPook says the sweet spot is 6 weeks, but we know that it can take up to 8 weeks. And so you're talking about a window of time where people are going to be closely monitoring their health if they believe that they came in close proximity of anyone infected before they can actually breathe a sigh of relief. So just because they get to the Canary Islands, there is still a lot of ground to cover after that before they get home and can actually exhale, Reed.
For sure, a story that's not going away, and neither are we. Tom Hanson, thank you so much for being on top of it. And a reminder for our viewers, coming up, I'm going to talk with an infectious disease doctor, William Scheffner, about the outbreak and your concerns. So stay right here on CBS News 24/7. Tom, have a good day. We have a lot more ahead on CBS News 24/7.